I feel like just the issue of mental illness. Well, I mean, for like Asian people or a lot of Asian countries, it's a taboo thing to even talk about because it's very looked down upon, and there's no like they don't really define the difference between like mild mental health issues and very severe mental issues, and the way that a lot of countries deal with mental mentally ill people is just to lock them away, and it's like it's just you'd be like you don't want to be a burden to someone else who just even talk about it. So there's not really any kind of education in terms of what mental illness is and whether you should even seek help for it. Like there are better things to focus on than how you feel.
Yeah, there are cultural barriers in a way, but I think just drawing on what others have said, it's like it's about, do you see it as mental health? You may understand the problem and have your own causes, so contributing factors. So most of the time we, especially for us that grew up in Africa, right, like we tend to know what the problems are and how can we deal with it. So for example, I wouldn't feel depressed if I don't have a job. I think I would go look for the job. Yeah. And I understand the process of getting the job is difficult in the first place. So I think with that type of mindset, which could be unique to me, but I see it across most African adults. I mean, African migrants that are here, especially those from difficult backgrounds. So knowing the cause of your problem and knowing how to deal with it could be one of the factors why we may not seek help, because we know the problem and we don't have to seek help. And two, when it comes to our culture, sometimes it's like just being mentally tough. I think there's a sort of gender distinction or differences to this in terms of maybe male or men who tend to look at mental health differently, while females would tend to look at it differently. But culture itself to tend to shame people within the process. Like once you say mental health, which is not wrong, there's nothing wrong with mental health, but there's a stereotype as though you have mental illness, and mental health refers to our mental state, whether ill or well. But once we say mental health, people think of mental illness. So that stereotype comes from our culture as well, and look upon people different. And I think with our culture, how open we are, how loud we speak, these things circulate within the community so quickly. Like
True.
People are going to know what's happening with your mental state. Yeah. And you might feel ashamed, and I think that's when culture played a role. But another thing I have realized over the years is like, why is it mental health or mental illness is being pushed upon people? That why has it become a major discussion point? Because, or some commentators have said, because like pharmaceutical companies are pushing these things to make a lot of money. So it's like medicalization of social problems, and we live in a world where we will have a lot of social issues, we will have problems. So do we really need pills for these things? Sometimes there are things we could deal with ourselves. So then pharmaceutical companies are making money off that, not necessarily that is a big problem. And that is more political in a way, but these are things we could consider. And I think lastly, we Africans, I think we are unique. I wouldn't want us to sort of bow down to European definition of mental health and how they deal with it. I think sometimes we are mentally tough, and we can use our experiences and resources to deal with mental health, not necessarily subscribe to a system or different culture which would be different to us and may not present the solution we need. So I believe that culture has a role, and what our own definition of our problem could be has a role as well.
Yeah, no, just touching up on that, like I think why we like as in like people coming from like African stuff don't really, it's really hard to seek like help if you have like a mental like illness and there's a problem there, is because like you said, a lot of black people talk, so you don't want to be, so a lot of people are kind of scared like with that as well. You be like, it might get out. So it's like, let's say someone like let's say a person that got raped or something, and like that's really mentally scarring for the rest of the life. They got raped, but as in Africa, because it happens so much, it's like we got the highest like rape thing in the world. So over there, it's like if someone got raped, they'll be really ashamed to talk about it, because it's like some like it'll go around and like here, especially here, since it's an African community and a lot of people talk to a lot of different people, so I might feel uncomfortable going to talk to like an elder or something about it. So, and like I just think it's pretty hard like to get at the same time I'm saying that what you said is pretty right. It's just like it's a mindset, to be honest. Like different experience, different ways to handle it, different ways like to look about it, like
Yeah, I think there's there's a physical aspect that has to do with the lack of or would I say inadequate mental health facilities in most African countries, and that has to do with how it's culturally perceived. So like you all have said, it's mental health and our culture for now don't really agree. You know, there's still a bit of a gap because of the stigmatization that has to do with being connected or being attributed with or being seen as someone who has got mental health issues. Like where I'm from, if you talk of mental health, you know, what everyone thinks of first is you're this close to insanity or madness.
Yeah, 100%, lock them up.
Yeah, you're just there. You're just there.
Yeah.
So you obviously don't want to risk discussing it with the wrong person, because just like you said, you know, we talk and before you know it, the next person knows it, and you're being perceived differently. You're struggling with something that everyone thinks makes you an entirely different person. So the stigmatization is there, and that I think is the main issue. And even when you decide to overlook the stigmatization, what facilities are there to come to your aid when you've accepted that you have these issues at hand, when you've accepted that, okay, I need professional help? How many health professionals actually focus on mental health issues in Africa? It's not really a big thing. And there's obviously the financial aspect too. It's obviously expensive. I don't know how expensive it is. I don't have any mental health issues, not that I know of. But you know, in Africa, we already have a couple of health issues we deal with. There's malaria, there's typhoid, there are so many other things. You can the average parent, for example, will not expect their child to come and tell them, I'm depressed. I think I need to see a physician. You say what?
Yeah.
You can walk. You don't have fever. You're fine.
You're fine.
That means you're fine.
Yeah.
Whatever you have that is going on in your head, sort it out yourself. Seriously, you can't walk up to my dad or my mom and tell them you're depressed. The first question is, how old are you?
Yeah.
What have you experienced in your life? So it's still the cultural, I still think it's still the cultural perspective that is the biggest issue, the stigmatization that comes with having mental illnesses. No one wants to feel or think that their child is struggling with something that is attributed to insanity. So,
or to them it might not be a big problem. That like to them it's like it's a little problem. Like let's say, like for example, before we talked about like looking for a job. Like some people it's a big deal, but like someone like me, I might be like, look, bro, like chill out. Like it's just a job. But some other people they look into that, be like, I'm depressed. I can't find a job. I've been looking for a while. So it becomes like that thing that keeps going into their head. Like it gets worse and worse and stuff.
I think growing up in Africa too, you're kind of like wired to be mentally strong.
Yeah.
So, and because it's seen as, for lack of better description, a white man's disease, you you just can't be seen as someone who isn't mentally strong enough as your peers.
Yeah.
You're built tough. That's how we were built. So you can't succumb to mental illness. You can succumb to malaria.
But what if it's not all in your head and like mental health associated like depression and stuff? There's like physical aspects to that too. And I feel like a barrier is just you wouldn't go to seek medical attention because it's not something you can physically see. And even if there are pills, there's like a stigma to the medication, like, well, it's going to numb you and like make you feel anything at all.
But I think, like, okay, just back to okay, in Australia, right? And I think, in as much as we are mentally tough in Africa, and especially for we men, right? And I think you don't want to succumb, you don't want to be seen as being weak, but there could be disadvantages as well. Over time, we may end up with certain maybe minor mental issues or that we may overlook, but these conditions are harsh and it may affect you mentally, but we may overlook it. So that's something I want us to be, aware of as well. But coming to Australia, I think there are many services, right? There are many services that once you type in mental health or mental illness, like there are so many organizations that are there providing services. But I think as well, like, are they culturally appropriate? That's one of the issues. And with our own mindset, it's like it makes a barrier. But there are so many services available in Australia. Maybe we don't think of it or we don't go after it because we just don't see it as a problem. And when we come in contact, sometimes there are other barriers too. And our expectations may be different to what they actually provide. And so these are problems. But I would agree that there are so many services. I have looked up mental health, and just in Adelaide, there are so many services available to treat and deal with mental health. And I think if we were to, that's what I was saying, like we should maybe devise an approach or mechanism to deal with mental health, because just having this conversation where we have had different views on mental health, and they are all accurate. But we could borrow, like for example, those that grew up in Africa and came here as adults have different views. Those who came here at a younger age or who were born here have different views. So we could compare that to the system and we could devise a way that would be treatment for us. Maybe not necessarily through medicine, but through discussion like this, or talking to each other could be a first step to treatment for us.
Still in Australia, even with the availability of mental health services, like you said, I don't know how comfortable I'll feel opening up to someone who shares a much different cultural background as I do. I don't know how well I can trust this person with things so personal about me, like my mental health. How do I tell you, I'm depressed, it affects my work, things like that will make me worried, would make me think twice before approaching someone for assistance with my mental health issues. Not like I have any. But that's one of the main things, and I agree with you. Yeah, is it culturally appropriate? Do you feel comfortable approaching someone else? Because for many people, they'll find it a lot easier to approach someone who they think processes information like they do. It'll be a lot easier to take in what they tell you than to take it in from somebody who you think is different from you culturally. So, but I think that gap can be bridged if the psychologist develops some sort of basis of trying to, or some sort of way of trying to understand people from culturally different backgrounds and trying to bridge that gap and making them feel comfortable enough to express themselves, in their presence. But that is always going to be an issue, especially for people who, like you said, grew up in Africa.
I think it's mainly a cultural thing, because it's like a lot of let's say back at home, it's normal for parents to beat their kid, to get them right in the right line. But over here, it could be looked as like abuse, and then the kid would be like worried, like get into that mindset where like they think they're mentally issued. Like to me, I feel like they think they're mentally like getting abused and stuff. But back there, it's like when my mom beat me in Africa, I'm like, okay, I know what to do and what not to do. So it was like the right like thingy. But it's like certain things like that could be looked at like mentally issues over here. It's like my mom beat me, so I'm depressed. I'm like mentally ill and all that stuff. But I think it's like more cultural thing, to be honest.
I was just wondering, are there different ways whereby mental issues can be defined with regards to where you're from? Because in Australia, for example, certain little things can be regarded as signs or symptoms of mental illness. Back home, it would be absolutely nothing.
Yeah.
So if I have those little signs and symptoms here, will I be perceived as mentally ill? Even though back home, I will not be perceived as mentally ill, even though when I evaluate myself, I will not consider myself as someone who is mentally ill. What are the yardsticks with which to say these are signs of depression or somebody who can do something stupid or other mental illnesses? What are the yardsticks used for people who live here, people who grow up here? Are they the same yardsticks you use for people who grew up outside here? Because I think they should be slightly different, or they should be fine-tuned to people from certain parts of the world. I don't know how it is in Asia, and I'm just speaking for Africa, but I'm sure you have your own issues, certain things that you can quickly overlook, but you wouldn't really overlook here.
Mental illness or mental health doesn't really exist at all.
Exactly, same thing. It's just because as in Africa, we do not know what mental issue is. So when I come here, it's like, how am I supposed to know I'm mentally ill? Like,
exactly.
What's the right thing? What's the right, what's the right way of, like, what's the thingy? Like, what's
if
the
If you're like mildly
experience
affected, you generally can't really tell by yourself.
Yeah.
And other people kind of point it out, and you're just like, oh, wait, what? There's something wrong with me now?
Yeah.
So.
I think the major issue is more about community awareness and community attitude towards it. I think that would be the major issue. I think it's easy to seek help. It doesn't matter if you are in a medical field or not. I think if we were to bring that at the forefront of the community, take for example, right? This is something I'm critical about when it comes to the community. We do lots of drinking, right? Like, it's not that we are alcoholics, but we do a fair bit of drinking, so we know most of the liquor shops around, So if you are, once we are interested in it, we don't have to have someone working with BWS or DMOF, but we know where to access these liquor shops because we are interested in it. It's at the forefront, like soccer and other things. So I think we should bring issues like mental health, social, certain social problems that may have impact on our community to the forefront. And these sort of discussions are very critical. Could spark someone to seek help or change the perception of someone about mental health. I think that's the biggest problem in my view.